My name's John, this is James. We're with the fire department. We're gonna get you all checked out, okay? They said you were having a stroke, maybe? That's what the dispatch said.
Okay.
Yeah, what are you feeling right now?
I got a headache.
Got a headache?
Yeah.
When did your headache start?
About an hour ago.
About an hour ago? Okay.
Yeah.
It looks like you're having some trouble talking. Are you able to smile for me? I'm gonna check for a facial droop here. Okay, so the left side is a little slanted. So we're gonna make this a priority, James. Get him to the hospital as quickly as we can. What about your hands? Or any weakness in your hands or your grip?
I don't know.
Not sure? All right.
No.
What we're gonna do, we're gonna check. Just want you to squeeze my fingers real tight. Okay, can you squeeze this left hand? All right, so your left hand's a little weak also. We're gonna have you raise your hands straight out in front of you, okay? Both arms. Okay, I'm gonna help you out with this one here. Try to keep that arm straight out.
Okay.
All right. All right, you can put that arm down. So you have a little bit of weakness also. Have you ever had a stroke in the past?
No.
No?
No.
Okay. Any family history of strokes?
Yes.
Yes?
Yes.
Now, do you smoke?
No.
Do you have high blood pressure?
Yes.
All right. And you haven't hit your head recently, have you?
No.
No? Okay. We're going to check your blood sugar real quick, and we're going to get you loaded onto the stretcher, and we're going to head up to the hospital.
Time. Do you know what time it is? Stroke is the fourth leading cause of death and the leading cause of disability in the United States. A stroke occurs when a clot forms in a blood vessel traveling to the brain, or when one of those vessels ruptures, robbing the brain of oxygen and nutrients. Once the brain is robbed of oxygen and nutrients, brain cells begin to die. Signs and symptoms of a stroke include severe headache, facial drooping, arm weakness on one side or another, and speech that's just not normal for the patient, whether it be slurring, garbled, or the patient is unable to speak to you.
Put that arm down.
If you notice any of these symptoms, call 911 right away. The mnemonic FAST will help you remember them. The F in FAST stands for facial drooping. The A stands for arm weakness. S for speech. And the T stands for time. Time is crucially important for these patients. Time is brain. Patients have about 3 hours from the onset of symptoms to be treated for those symptoms. That means when they first have the headache, or you first notice their speech is garbled, or they first have weakness on one side of the body or another, time is very important. If you suspect someone is having a stroke, call 911. Do you know what time it is?